Welcome to my channel, Sensitization channel. My name is Nosonyamowo, and today we shall be discussing danger signs in pregnancy. If this is your first time coming across my video, please remember to subscribe and turn on your notification button so that subsequent video will be alerted. Danger signs in pregnancy. These are the things you see during pregnancy and requires urgent medical intervention. In our subsequent video, we shall be discussing these signs in details. First is vaginal bleeding. Although we have implantation bleeding, which occur within 10 to 14 days after conception, and it is usually very light and lasts for 2 days. Any bleeding outside this should be taken as a dangerous sign which requires urgent medical intervention in order to save the life of the mother and the baby. We have severe headache, which may be signs of eclampsia, preeclampsia, high blood pressure, and others. We shall be discussing that in detail in our subsequent video. We have lymph drainage. Lymph drainage is also a very dangerous sign where the amniotic fluid, which cushion the baby, provide warmth for the baby, protect the baby, and also serve as a source of nutrient between the mother and the baby, is being drained. If lymph is usually drained if and during labor. If labor has commenced and during labor. As such, any drainage outside labor should be taken as urgent and medical intervention be seek. We have swelling of the face, swelling of the legs, swelling of the hands. All these are dangerous signs which requires urgent medical intervention during pregnancy. We have fainting and dizziness, which could be a sign that something is wrong. We have convulsion. Convulsion imposes the life of the mother and especially the baby, because during convulsion there is low or no supply of oxygen to the baby. In our subsequent video, we shall be discussing the causes of convulsion during pregnancy, the complications that may arise if medical intervention is not sought on time. We have overwhelming tiredness. Although during pregnancy, because of hormonal activities, the pregnant woman tends to be tired. But if the tiredness is overwhelming, you need to seek urgent medical intervention in order to be treated accordingly. When there is reduced or no fetal movement, fetal movement is felt after 16 weeks of gestation, and as a mother, you need to take note of the frequency and the number of times your baby moves, so that if there is no fetal movement or there is reduced fetal movement, you need to seek other urgent medical intervention when scan and other investigation will be carried out to ensure that your baby is safe. Also, if you experience severe abdominal pain during pregnancy, it's also a dangerous sign, except during labor. And for a term pregnancy, it is calculated as from 37 weeks upward. Any pain Any severe lower abdominal pain during pregnancy requires urgent medical intervention in order to save the life of the baby and the mother. Dizziness and fainting also is a sign, a dangerous sign in pregnancy. We have persistent vomiting. Although during pregnancy, vomiting is normal, but when it is persistent, you need to seek medical intervention where you'll be rehydrated, given fluid in order to save the life of the baby, in order to reactivate or replace your electrolyte that was lost. Also, if you have fast breathing and chest pain during pregnancy, you need to seek urgent intervention, because if the breathing process of a pregnant woman is impaired, it also affects the baby directly, because the baby depends on the mother's oxygen for exchange of gases, circulation, and other things. Loss of consciousness. Loss of consciousness is a very dangerous sign in pregnancy, regardless of the time interval. As such, if you notice loss of consciousness, report to the hospital immediately. In our subsequent video, we shall be discussing in details the causes of these signs and the complications of this dangerous sign in pregnancy. If this is your first time of coming across my video, please remember to subscribe and turn on the notification button in order to be notified of subsequent video. And please remember to share to friends and family, especially prosperous mother, expectant mother, in order to save our mothers and our baby's life. Thank you.